Health and social services in Auckland say delays in transferring COVID-19 patients into quarantine are putting struggling families into a tight spot. Providers say the delays are partially caused by capacity in the managed isolation and quarantine system. The Prime Minister admits the delays but says capacity isn't the issue. Our reporter Chin Yu has more.
The total number of cases linked to the current community outbreak is 347. The Ministry of Health website says 145 of those are in managed facilities and 63 are at home or self-isolating. The whānau is providing support to households with members self-isolating. Its Chief Executive, 3a0e Funaki, says it's hard for someone to properly isolate when there is a positive case at home.
It's just difficult, especially those that, our families in Pacific are big families, and the challenge of actually getting to isolate. How do you isolate when there's 6 of you or 8 of you in 2-bedroom house?
3a0e Funaki says apart from limited space, the families are also in need of supplies, including hygiene products and food. He says it's a massive challenge.
Even with the food supply stuff that we're trying to supply, to try and tailor to the family and the key essentials. The key essentials are pretty, we know, some of them need medicine, some Panadols and therapies just to ease the symptoms. But we've got major issues around food supplies.
3a0e Funaki says it's especially hard for families split between homes, hospital and quarantine.
The challenge around the literacy, around just the understanding of what isolations mean and how serious this delta is. Because there's a positive case in there, how do they isolate, how do they support that person that is a positive member of the family?
Another social service provider, Pacifica Futures, also says there have been delays. Its Chief Executive, Debbie Sorensen, says her organisation is supporting families isolating with food packages, bills, children's devices, accommodation and mental health needs.
Certainly the delay makes, a complex situation, and families who are under pressure already feel more pressure. But, it is the nature of the outbreak. The outbreak is a substantially big outbreak.
Debbie Sorensen says government agencies have worked well to meet increasing needs during this Delta outbreak, but things could have been better. She says there had been discussions about surge capacity over the last 12 months.
That capacity wasn't put in place, and so it has meant that there has been, a scramble really in the first couple of days of this outbreak to get everything up to speed.
Joint Head of MIQ, Brigadier Rose King, says the team are processing referrals as soon as they receive them. But it's not always possible to transfer people on the same night as a referral is received. Prime Minister Jacinda Ardern says there are 274 quarantine rooms across the country and a further 285 available for close contacts. She says more than 200 additional rooms are being made available today. Ms. Ardern says the delay is not due to capacity and a specialist team is used to carefully transport people.
We have people trained for that. We use them in our existing network for transporting people from a managed isolation facility to the jet park, and we're using that same team. So because we are just getting so many contacts in a new day, sometimes it's taking a bit of time to get everyone into a facility.
The Director General of Health, Dr. Ashley Bloomfield, says there is no further risk to households with a positive case, as they would be isolating separate from their bubble. He says some families would be prioritised.
Sometimes the family group is quite large, and so it's harder to do that. So those are the families that are prioritised for being moved. And also, very early on, the very first discussion is to make sure that any welfare or other needs that they may have are being met.
Dr. Ashley Bloomfield also says people who find it unsafe to isolate at home and feel they might become a case are prioritised for transfer to MIQ.